Welcome, Dr. Ataii. Thank you so much here at 4Smile. So tell me a little about your background in...
Well, first of all, thank you for having me. My background. Going back as far as a dental background, the past 24 years, I've been blessed to have this office here in Laguna Hills and servicing the South Orange County patients, and not just advising them, but treating them, being friends with them, and most importantly, trying to give the word out that we're dental physicians. So, and teaching the seminars and talking to my peers, I really appreciate your time and having me here today.
So tell me a little bit more about your practice and what you're doing for your patients.
Absolutely. You know, we've been here over 20 years, and my patients have all become friends, and our main goal is to give a multidisciplinary type of dentistry. So whether they need teeth that are treated, or roots that need to be treated, or implants that need to be treated, our agenda is to do it all here. I bring specialists here. They've been with me over 10 years, and even my hygienists in front office, some of them have been with me almost 20. So my goal is to have a team that if we can't help you, then probably it's something that's more difficult than need to be. Otherwise, I've been able to kind of hand this over to my patients as a one-stop shop that we treat all patients from all ages.
That's great. So you don't have to keep going and coming back in different areas. That's great.
Yeah.
Great. So what can a really good smile do for someone, and how do you feel it can change their life?
A good smile for a patient really depends on two things. Number one, personality. You know, some people don't like to smile because they're worried about their actual smile line, versus some people have big smiles and they really don't care what their smile looks like, but just the spirit of them glows. And really, for me, I want to bring out the best in everyone's personality, whether it be through a smile or just through a simple whitening or cleaning.
Yeah, there's a lot of options out there right now with clear aligners and veneers. There's all sorts out there. What are the difference between them, and what do you recommend?
Well, clear aligners have been coming along really well in the past 14 years. When you start to look at patients and them wanting a whiter smile, it's always about whitening, but their teeth are overlapping, and the shadow that creates in the overlapping creates that potential grayness. When the reality is, if you straighten them, you align them better, now just a little bit of whitening will allow you to have a better smile.
Yeah, and what's the difference between Invisalign and all the other competitors out there? There's so many.
Sure. Well, you know, when we started talking about Invisalign over 14 years ago, it's as if I had 2 ears and a tail growing out of my tail saying, look, clear aligners will replace wire and brackets when it comes to teeth movements. Now, as we see patients that are actually doing it at home and doing it themselves, we're seeing that clear aligners such as Invisalign and other companies are becoming in the forefront of orthodontic practices. So for me, Invisalign is a great tool, and there are other tools, but the clinician really needs to talk to the patient to pick the right product for their smile.
Yeah, and how many appointments do you think a client might need if they want to come in and have aligners?
Typically, an average aligner treatment could be anywhere between 6 months to a year. That's anywhere between 4 to 6 visits. Remember, a lot of it's being done at home, especially in today's climate. You want to see the patients at home, and we kind of track them through a digital software that we have.
Oh, great. So are there any other options apart from aligners that you use? Or
yeah, so think about someone's smile. If they are not planning on moving it or putting it in a better place, what else can we do? Well, the reality is you can do multiple layers of not just from veneers but whitening, but just to give that smile line for a quick setup, for that evening's smile potentially, or you want to have a full year and the rest of your life smile. And typically clear aligners help me put that final touch to their smile.
Yeah, perfect. And we all want white teeth, and there's so many options out there right now for white teeth. Like, what do you recommend?
Well, you know, when we first started laser dentistry, for us, a lot of our patients figured that the lasers will be great for whitening. The reality is, lasers are great for antibacterial and antimicrobial, and they will whiten the teeth. So options for whitening for me, the at-home version is just as sufficient as you doing it in office. The difference is time. Do you want to spend half an hour, or do you want to spend 4 or 5 days doing it? And that's a decision we give to our patients to make.
Yeah. And you're such a busy person, and I don't know how, but you find time to do classes and seminars. So tell me more about that.
Yeah, so I've been recognized nationally in teaching doctors what's called clinical education and furthering their clinical experience. And I've been blessed. You know, I stand in front of a few hundred doctors and peers and talking to them about the different options they have in dentistry. And it's helped. It's helped progress the market for dentists into a position where we're now considered as oral health practitioners. And actually we're physicians, not just a dental tech of some sort that patients want to just replace a tooth.
Yeah.
But instead we're really helping them with their oral health.
Yeah. Now, COVID-19, it's changed everything in the way the world's operating, especially dentistry, I'm assuming. How do you feel it's impacted dentistry, in your opinion?
Well, first of all, COVID-19...
That's why we're 6 feet apart.
Yeah, just us being the distance is one.
Yeah.
Look, in my office, I doubled down in my office. We put an HVAC in here. We actually do a COVID testing for our patients. We take the temperature. We do the social distancing. But most importantly, I think it's going to affect the patients. Look, we've treated all of our patients and make sure that we countertops and everything's being cleaned after every patient. It's nothing new to us, especially in the dental profession.
Yeah.
What's changed is the cost of doing now. So potentially patients can suffer from an end of, okay, so who's going to pay for these expenses?
Yeah.
And that's where I see the trend changing, and the reality we've been trying to keep it where we are helping our patients not to be taxed with those expenses.
Yeah.
But it's something that every dentist has been practicing since dental school that we've been taught.
Yeah. And regarding the mouth and COVID-19, do you think there's any relation to that?
Absolutely. You know, the relationship that the oral health and the oral mucosa has is, think about COVID-19. It's a viral that catches you when you're immunocompromised. So if you have teeth that are periodontally a problem, or you have plaque, or you have buildup, that in itself is bacterial. Bacterial then is doing what? It's compromising your immunity. And that compromised immunity is what COVID-19 goes after. So in my world, oral connection of health is definitely a relationship that COVID-19 is going to kind of accelerate itself in patients who are immunocompromised.
Yeah. And why Laser Dental Center? I have to ask.
So Laser Dental Center, when we first started about 20 years ago, was an anomaly that no one really understood, that it's important for us to disinfect the mouth. It's important not just to kind of do the Star Trek blue light, because that's just a blue light, it's not the laser, but instead when we do a filling or remove silver fillings, the laser now goes and cortages and cleans out not just the gum line, but the teeth. So it's really an antibacterial. We've been using antibacterial resins and fillings and white fillings for over 20 years. Now, dentists are gravitating towards me saying, what was that filling you were using? Because antibacterial, antiviral, those are important in today's conditions of the COVID-19. So lasers is just another tool to help you disinfect and do a better job than just your traditional drill and fill.
Yeah. And is there anything that you can advise our viewers at home at 4Smile to do at home regarding oral hygiene? Like, what can we be doing other than the brushing and the flossing?
Well, definitely the brushing and flossing is key. I believe that whether we like it or not, the idea of exerting some sort of a saliva as you're speaking or as you're talking, you know, I do believe that there is bacterial in the mouth. Obviously, we all have it. And to keep clean, at least a visit to the dental office once every 6 months is at a bare minimum. So that way you're having a professional cleaning, not just relying on the floss and brush. Brushing your tongue. Brushing your tongue. The tongue harbors a lot of bacteria, and patients tend to miss that. And sometimes they say, I gag. Well, you can use a tongue scraper, right?
I've got a tongue scraper.
There we go. So brushing the tongue is key if you're at home.
People, they forget about the tongue and the other thing. They think it's just about the teeth, but it's the overall mouth hygiene,
Absolutely.
So what else do you feel that patients can be doing at home during COVID-19?
Well, other than brushing and flossing and really brushing their tongue, I think oral hygiene is important. Visiting the dentist once every 6 months. Given today's climate, I've been able to use 4Smile's camera, the intraoral camera, to send home, and my patients now are able to kind of use a digital camera, upload the photos. We're doing now a live chat, and that kind of keeps me connected. If I see something going on or the gums are starting to turn red a bit, now we're going to talk about the bacterial effects and how they can treat it at home.
Well, this seems to be the way of the future now, virtual dentists. So, advice to a mom. I have a 12-year-old daughter at home. It's quite hard to get her to brush her teeth, and she's at that phase where she's kind of snoring or doing something kind of weird in the night. Can you give me any advice as a mom?
Yeah, it's funny because we actually, during the age of 6 is when you get your first loss of molars and the adult's teeth are coming through. Around age 12 is when the other teeth are coming through, the bicuspids. And for us, we advise parents, look, here's what's happening. The patients typically are laying flat on their back as they're growing, and the mandible's dropping back. So if they are having snoring or they're having teeth growth, they sometimes tend to clench and grind their teeth. Sometimes that could be an airway problem. Sometimes that could be that they're actually their tonsils or uvula, or even blockage of the airway. And there's oral appliances that can be fabricated to help put the teeth in the right position as they're growing out.
Oh wow. Yeah.
That way it'll help your smile, it'll have a beautiful smile when they grow, and it can avoid you having to go through the wire and bracket and headgears, all the stuff to kind of put their teeth in better position.
Yeah.
So if you have a child who's snoring, you got a child who's got teeth that are growing, definitely be advised that you need to go see a clinician right away.
So regarding COVID-19, do you feel there's any relation between the mouth, oral hygiene in general, and COVID-19?
Absolutely. You know, as a dental practitioner, we have to advise our patients not to just be able to brush or floss at home or even scrape the tongue, but understanding that there are patients who are mouth breathers. There are patients who have they sleep with their mouth open. And if you have that virus within you, now your bed partner or the person next to you could potentially have that. Think about sleep apnea or patients who are wearing that CPAP.
Yeah.
Right? That in itself could potentially be pushing out that same virus that you're trying to protect yourself from. So now we're talking to our patients about potentially using oral appliances, using sleep appliances rather than a CPAP. And that in itself could help patients. And there's definitely an oral connection between COVID-19 and what we see in the mouth.
And regarding mouthwashes and things, do you recommend everybody uses a good mouthwash?
Absolutely. Look, flossing and brushing is key. Mouthwash, to me, is the disinfectant portion of it. Now, a lot of controversy. Hygienists sometimes say you got to floss first, then you got to brush, then you got to do the mouthwash. For me, personally, I feel cleaner once I floss, and now I use a mouthwash. I do like, not to promote any brand, but mouthwash that have a little bit of alcohol base in it, but not predominantly alcohol. I like the Act mouth rinse. You know, the Listerine or the Scopes, you see sometimes the alcohol content might be too heavy, and it kind of burns, especially for kids. Very difficult for them. So for me, I like to floss, mouthwash, and brush. That's the way I exercise it. You ask my hygienist, she'll tell you something else.
Okay. And this is an interesting one. So as a child, I grew up being told to brush twice a day, once in the morning and once in the evening before bed. Do you think that's pretty much standard, or do you recommend more? Or
I twice a day is bare minimum. Yeah, you can floss maybe once before you go to bed, but at least brushing and flossing and rinsing twice a day is absolute minimum.
Yeah, great. And I've heard of something called oil pulling. Are you familiar with oil pulling? Because I just learned about this, so I just wanted your opinion.
Yeah, there are a lot of, so the idea is to reduce the acidity in the mouth, right? So as you sleep at night, your acidity in the mouth, your mouth gets dry, and that acidity tends to do a lot of damage to the enamel. Once the enamel is broken through, now bacteria and decay can get into your dentin. So, those types of oils reduce the acidity at night while you sleep.
Perfect. Yay. Thank you so much, Dr. Ataii. We really appreciate it and all your advice. Thank you here at 4Smile.
Thank you.